of research. My name is Chioma Moye, and I'm one of the student interns for the Center for the Study of Race, Politics, and Culture in the Human Rights Lab. Research Bites is a speaker series that aims to build community between the center's faculty affiliates and staff members in order to improve how we support and amplify one another's work. You can subscribe to our Research Bites in the CSRPC listservs to be notified of future conversations. The first 25 staff members to register for Research Bites events receive a $25 Grubhub gift card or credit to buy lunch on us. Congratulations to those who are enjoying their lunches now. Thank you, Tiara, Beth, and Arsima for your work behind the scenes and tech support to sending out Grubhub gift cards. And today we'll be joined by a very special guest, Dr. Doriane Miller. As a general internist, Doriane Miller, MD, has been providing care to underserved minority populations for more than 20 years. In addition to her role as a primary care physician, she has special interest in behavioral health. Dr. Miller's research focuses on the intersection of health, disparities, and race. She has served as the project director for several studies designed to augment care by promoting collaboration among physicians, patients, and families. Dr. Miller's work in the area of improving asthma outcomes through school and community interventions was noted by the American Academy of Asthma, Allergy and Immunology with the 2006 Special Recognition Award. Please give a warm welcome to our friend, Dr. Doriane Miller.
Thanks for that warm introduction, Chioma. Looking forward to sharing information with the people who have gathered here today on a project that I've been working on for the past couple of years. In thinking about the phrase research bites, I was thinking a little bit about perhaps sharing research findings or information, but actually I'd like to share the opportunity potentially for particularly some of our early stage investigators who are on the call today that may be interested in perhaps applying for funding through the program that I'm going to have the opportunity to share with you. So I'm going to start sharing my screen, and I will get started with the presentation. Let me put that in screen share mode, and let's see here if we can. Very good. I am one of the co-investigators for the group, the Chicago Chronic Condition Equity Network. This is a study that is funded through the National Institutes of Minority Health and Health Disparities to look at some of the issues where there may be research gaps in terms of the improvement of helping people who have chronic health conditions within the Chicagoland area, and to look at some of the factors that are involved there. And so I'm going to provide you with a bit of information about what we're doing. But before I get started with that, I'd like to provide you with a little bit of a context as to why our group applied for funding for this project. The slide that you see in front of you is taken from the Healthy Chicago 2025 report and was published in a monograph from the Chicago Department of Public Health on the state of Black health in Chicago. This particular slide looks at the drivers of the gap in life expectancy amongst racial and ethnic groups within the city of Chicago between the period of 2012 and 2017. Oftentimes, if you talk with people who are outside of the Chicago area or who are not related to the delivery of health or healthcare, they think about particularly the Black-white gap that we see within the city of Chicago as being primarily related to the bottom four areas that you see here in the slide. Unrelated homicide, infant mortality, HIV and infectious diseases, and also opioid use disorder. However, as you can see up here in dark maroon at the top, it's actually chronic diseases that's the main driver for the difference that you see in life expectancy. Now, mind you, there's always been a gap there, at least going back to 2012 in terms of these groups, but we actually saw even more of a fall between 2012 and 2017. And one of the things that we've seen during the COVID-19 pandemic is even a further drop in terms of Black-white life expectancy within the city of Chicago. And particularly, we think that this is due to, both in the Latinx community as well as the African American community, a drive because of chronic diseases. So the question that you may have in your mind right now is, what are some of the reasons or factors that we see this difference in life expectancy? And so I'm going to address that in the following slides. When we think about health disparities in the Chicago area, there are multiple factors that contribute to this. Racial segregation and structural racism being one of them, poverty, and also access to high quality health services. And as I'll unpack in some of the following slides, these are some of the things that some of you may be familiar with in terms of some of the area deprivation index information. So we'll get to that in just a moment. In terms of the issue of racial segregation in the city, many of you are probably familiar with the fact that oftentimes Chicago was referred to a hyper-segregated city. The slide that you see here is taken from the WTTW Firsthand Segregation interactive digital series, in which they take a look at census data from 2020, and they've developed this frequency map that shows you where people from specific racial and ethnic groups live within the city of Chicago. And the dots represent the density or the numbers of people who are living in those areas. For many of us, this is not really a surprise. We're pretty familiar with what we see as we go up and down Lakeshore Drive from the south side, where we happen to be located on the University of Chicago campus, all the way up to the north side. So in terms of the coloring here, the color blue represents the Black or African American population. The color red represents the white population. The colors that you see in green are the Latinx population. The purplish areas that you see here are the Asian population, and then there's other. Again, you can see here that the populations are fairly segregated in terms of communities, with a greater concentration of whites living in the north and northwest sides of the city. The area that you see down here that has a little bit more of a smattering of the white population is actually where we happen to be here in Hyde Park, in the Hyde Park-Kenwood area at the University of Chicago. The other thing that you note here on the south side of Chicago in terms of the concentration of white that are in this area, and that's the Mount Greenwood Beverly area. And that's because of the restrictions that policemen and firefighters must live within the city limits. And so oftentimes there's been a longstanding south side population that's existed here on the south side of whites because of that particular city restriction. Some data taken from the 2010 American Community Survey area. We're going to go to the issue of poverty now. This is taken from a map from the Chicago Department of Public Health, which is the hardship index. For some of you who are sociologists, you may be familiar with the term area deprivation index. And this takes a look at what exists within Chicago communities in terms of poverty, broken out by the 77 Chicago community areas. The types of measures that are put in place here include crowded housing, the poverty level of a particular community, unemployment rates, adults without a high school diploma, dependency, that is either people who are under the age of 18 or over the age of 64 who typically are not in the workforce, and also per capita income. The darker shades of purple that you see here are neighborhoods that have higher hardship indices or area deprivation. Area 41 here is where the University of Chicago is located, with Area 39 just to the south being the Kenwood area. And as you can see here, many of the communities that are considered to have high hardship indices are actually in close proximity to where we are here at Area 41 in the University of Chicago. And specifically, I'll point out to you the neighborhood that is just to our just to our west. the Washington Park community, and I'll turn to the map that you see just over on your right. This is a map that was taken from the website of the Center on Society and Health from Virginia Commonwealth University, in which you can see not just for the city of Chicago, but from a number of cities across the country, essentially the differences in life expectancy based on very short geographic distances. So we're down here in Hyde Park near the Museum of Science and Industry here at the University of Chicago. But you can see that our neighbors just to the west of us here in the Washington Park community have a typical life expectancy of about 69 years. If you take that in comparison to people who live in the Loop Streeterville area a little bit further up here, again, a 16-year gap. Now, the question of whether or not people, the impact of healthcare facilities here, I think in transportation is something else that I wanted to bring to your attention. This is a density map that looks at the location of healthcare facilities and also their proximity to the CTA train lines that exist within the city of Chicago. So if you, I'm going to go back for just a moment to show you the L lines here that are outlined in the colors. And so folks are probably pretty familiar with the green line. The red line, which is the one that goes down the middle of the Dan Ryan Expressway and then goes up north into the north side of the city. The orange line, which takes you all the way out to Midway Airport, and then the extension of the green line out to the west side of the city and out to Oak Park. So those are the ones that we're talking about. We can see on this map a concentration or a higher concentration of healthcare facilities more centrally, with lower densities within the south sides of the city and to a certain extent on the west side of the city as well. But if you think back to that map that we were looking at just a moment ago in terms of the concentrations of particularly African-American and Latino communities, there's a lower density of healthcare facilities that exist within these communities. Now, mind you, that's not the only driver in terms of where people can receive healthcare, but certainly the question of being able to have access to hospitals, secondary, tertiary care facilities like a Northwestern or a University of Chicago, it's much limited for people who live in these communities. The Chicago Department of Public Health started to look at these issues about 6 or 7 years ago and decided to develop a citywide health improvement plan that was aimed on closing the life expectancy gaps that I showed you just a moment ago, and really engaged in a community co-led planning process in order to look at some of the factors that I mentioned before. And so I'm demonstrating this graphic, which I think is very telling in terms of the kinds of things that the city of Chicago would like to focus on in terms of health and well-being. And as you take a look at this tree that's in front of you, you may say, a lot of the things that I see here really aren't about the delivery of healthcare from the perspective of a hospital or even a doctor's office, but they have to do with things that really make up some of the things that I mentioned in the area deprivation index. So things like public access, public safety, food access, housing issues, health and social services in a community, looking at the development of vibrant neighborhoods, looking at clean air, and then also the factors down below, which are really the roots in the tree that speak to some of those social and institutional inequities when we think about structural inequities and structural racism that exist in these communities. Public accountability for how these things get solved. The development of economic opportunities and regulations, and also anti-racism and multicultural organizations that feed into this in order to really create and to generate vibrant communities. And so this is the framework for Healthy Chicago 2025. And you probably are asking yourself at this point, okay, she's laid the groundwork for this. How does the work of the Chicago Chronic Condition Equity Network fit into this framework? And so in the following slides, I'll talk a little bit more about that. As a part of the Healthy Chicago 2025 framework, the Healthy Chicago and the Chicago Department of Public Health applied for federal funding in which they were able to develop Healthy Chicago equity zones. These zones are led by either community-based organizations or healthcare delivery systems and have been designed to deploy hyper-local strategies to address these social and environmental factors that contribute to the inequities that we see in the city of Chicago, closing or at least narrowing Chicago's racial life expectancy gap. So as you can see here, that they've been organized into geographic zones. The ones that we've been working with within the Chicago Chronic Condition Equity Network are the ones that are on the near south side, the far south side, and also the west side. And these particular zones are headed up by the Greater Auburn Gresham Development Corporation on the near south side rather. On the far south side, Phalanx Community Services, which is located in the Roseland West Pullman Park neighborhood and is a community-based organization. And then on the west side, it's headed up by West Side United, which is a partnership between community-based organizations and Rush University and Rush Medical Center through its work through the Rush Institute for Health Equity. And so we actually have partnered with them, and working with them is the basis of the work that we're doing through the Chicago Chronic Condition Equity Network. So a little bit about our goals for the Chicago Chronic Condition Equity Network. We're looking at ways in which we can identify solutions to addressing inequities in multiple chronic conditions in the Chicagoland area. We're focusing on cardiometabolic health, specifically looking at ways in which we can improve the health and well-being around people who have conditions like diabetes, heart failure, hypertension, and others, but also the factors that add into these things. And some of those things include issues around violence and trauma in neighborhoods, issues around places where you can get healthy foods. And so that really does speak to understanding the role of some of these contextual or intersectoral factors in neighborhoods, looking at some of those social drivers of health, mental health issues, and their impact on multiple chronic conditions. The other two things that we're working on is that we really are working at engaging community partners in a meaningful way throughout all phases of the research cycle. So it's not just researchers coming in saying, I know what your problem is, I've identified it, and this is what I plan on doing as an investigator from a university to help to solve your problem, but really asking the questions, what are the things that you think are important in terms of helping to address these issues, and how can we partner together around them? And then finally, we're trying to stimulate collaborations across academic institutions, clinics, regions, and community organizations. And so even though the lead organizations from the university side for this project are Rush and the University of Chicago, we actually have grantees that have come through this particular funding mechanism that come from other institutions as well. And I'll get to the funding opportunities in just a moment. In terms of our specific aims, we are not only building this as a 5-year demonstration, but we're actually building this as a larger network to build a Chicago regional community-based research network in order to build on these collaborations with the key stakeholder groups that I mentioned a moment ago. So community-based organizations, networks of ambulatory practices, including federally qualified health centers that have been really key in terms of the work that we're doing. And they've provided some leadership in this particular grouping. Academic institutions as well. And then not only are we providing cutting edge research support and expertise to facilitate our work in this area, but we're doing it across practice networks where people receive their healthcare through healthcare delivery systems. We're looking at this from the perspective of people who are encountering their health and well-being through a community-based organization. And even in some of our grants, and I'll talk about this a little bit later, engaging in interventions that take place within the home. And then finally, and this is where I think that the opportunity comes up for new investigators, particularly early stage investigators who are interested in working with us. We are providing education and training and mentoring and support, not only for investigators, but also community-based organizations through some pilot grant funding that we have, as well as other research support. So I'm going to shift now and talk about the components of our programs and also the various cores as a part of the Chicago Chronic Condition Equity Network. And so C, the digit 3EN is our tag, and we'll have our website available for you before I complete the presentation. So again, the components include our Investigator Development Core. A requirement of this grant was to have established investigator programs included in this, in addition to the early stage investigator development core. All of this work is in the interface between our community-based organizations and community leads is done through the Community Engagement Core, where I'm one of the co-faculty leads, as well as two of my colleagues from Rush University, Dr. David Ansel and Dr. Sheila Dugan. And then all of this is coordinated through our administrative core for the group. So let's go through the various components. In terms of the Investigator Development Core, this particular core is responsible for administering research pilot grants. They are typically between $50,000 and $60,000, and we aim these at early stage investigators who are interested in doing health disparities work, primarily, although not solely, around the factors that impact cardiometabolic disease. And we strongly encourage collaboration with community partners. Now, I mentioned a little while ago that the community partners are rather broad. They can be community-based organizations, healthcare delivery systems, or faith-based organizations, but we really do look for that level of collaboration in terms of the evaluation of those grants. In addition, we have a mini grants program that is designed to support and strengthen academic and community collaboration, in which the mini grants can help investigators in partnership with a community partner to identify priorities for collaboration, and also to help to inform the design of a research project. So if you think about this as being kind of the pre-work before one might apply for one of our research project grants. And then also it's a way of demonstrating the researcher's commitment to the partnership. Now you may be saying, what does that mean? And one of the things that we think about in terms of providing this particular support to a community partner comes from the voice of our community partners themselves, in that they are sharing their wisdom and expertise around what might work in a community setting. But in the same way that the investigators need to have funding in order to be able to do their work, community partners need to have funding in order to be able to participate. And so oftentimes building this in not only to the planning process through the mini grants, but also we ask our research project pilot grants to do this as well, to build in a budget for the participation of their community collaborators, is a real demonstration of how we provide financial value to the work and the contributions that the community partners are giving. In addition to that, we provide technical support and resources through our administrative core for those early stage grantees, lectures and support from more mature and seasoned investigators. A few examples of the grants that we've given thus far through the Investigator Development Core. You can see here Project Connect, using implementation science to access trauma treatment for individuals with co-occurring chronic conditions. One of the things that we've found with people who have chronic health conditions, that oftentimes if they have been exposed to violent trauma in the communities, that's actually something that unfortunately can prevent them from taking care of themselves in the way that they should. And so oftentimes by providing trauma treatment for these individuals, they can actually have improvements in their underlying physical health conditions. Legal care for caregivers to violently injured adolescents and young adults. Again, this is an issue that's occurring in communities, and oftentimes this particular care is not necessarily available for people who have been violently injured. The issue of smoking-related health disparities and high rates of cigarette smoking within our Chinese population in Chinatown and the underground cigarette market, and thinking about ways in which there can be interventions there. The HEAL project that's mentioned just below it is specifically targeting middle-aged and older African-American women and the impact of stress on high blood pressure and obesity and ways in which interventions can be done there. And then finally, Brotherly Act, developing a novel equity-focused coping and life skill digital tool. And this, I think, is particularly relevant in these times when we're thinking about the rise of artificial intelligence in ways in which it can support society, this is something that's also, I think, a very important project in terms of thinking about support of the mental health of young Black males in Chicago. This list, mind you, is not comprehensive. We've had 2 funding cycles to date, but I'll tell you in just a moment where you can go onto our website to learn a little bit more about some of the projects that have been funded. I mentioned a moment ago that we had to put in R01s in order to be eligible to get funded for this program. And so these are the ones that were implemented for this particular project. Keep It Moving is a faith-based partnership with investigators at Rush University, focusing on physical activity for people who have chronic health conditions. And they've partnered with the community partner, the Alive Faith Network, in order to implement this program. Avita is a virtual diabetes group visit program, which looks at a comparison of group visits that are done via virtual Zoom meetings across a number of systems. And so Advocate Health, Access Community Health, which is a federally qualified health system organization, along with the Midwest Community Clinician Network, is focusing on this program. And then I mentioned actually doing interventions in the home, and that's what the Engage program works on. This is headed up by one of our University of Chicago investigators, a geriatrician, in which he has developed an in-home exercise tool for homebound African Americans that is actually a digital assistance tool for people who are homebound in order to help them to start doing more exercises at home. And this is a partnership with the organization Mather Lifeways, Age Options, as well as the Illinois Department on Aging. So again, we are actually mirroring what we're asking our early stage investigators to do in terms of thinking about how they partner with community-based organizations, whether it be CBOs, public health, state institutions that focus on public health, or provider-based organizations. In terms of the community engagement core, we manage a group of community stakeholders that include healthcare providers, community-based organizations, public health representation, and faith-based institutions that are providing us with counsel on not only how to move this project forward, but they also review the grants that come through the pilot grant award program. We meet with them regularly in order to ask them their advice and counsel on how we should move forward with this project. In addition, we have larger community town halls where we meet with people who live in the communities that are involved through those Chicago Health Equity Zones, as well as others that are in some of the collar counties in Chicago. And so we've got a partnership with the Kane County Department of Public Health as well. And that we've been doing information gathering and some research prioritization for those early stage investigators. And then in years 4 and 5, we're going to go back to those community town halls to present the research that has been developed based on how the research prioritization has taken place for those early stage investigators, to share that information back with the community. And so that will really come to the dissemination of actionable research to these community partners. I didn't mention a moment ago, but I will now, that the Community Stakeholder Advisory Council is actually chaired by our community-based partners. And so Vernita Bacchus, who is the president and CEO of Friend Family Health, is one of our chairs, along with Raul Garza, who is the president and CEO of Aunt Martha's. So again, as opposed to making this more of an investigator university top-down approach, we really are leveling the administrative structure structure and advisory field here in terms of having our this work really chaired and driven by our community stakeholders. Just some of the tasks of our administrative core in terms of providing strategic direction and leadership and making sure that we have proper alignment amongst our university investigators and also our external stakeholders, as well as supporting our administrative processes. They also help to foster collaboration and scientific opportunities among our stakeholder partners. One of the things that, in having a large center grant like this, is that oftentimes without that type of coordination, you can have issues with the right hand not knowing what the left hand is doing, but being able to have this coordinated through our administrative core brings our partnerships together, as well as leveraging institutional partnerships and resources so that we can make sure that we can continue to attract diverse investigators who are new to the study of this area and the area of multiple chronic conditions. This is our funding information and our two principal investigators, Elizabeth Lynch, who is a psychologist at Rush University, Albert Wong, who is a professor of medicine here at the University of Chicago. This work will go on through 2026. And if you're interested in additional information, please look at the SCENE website, particularly if you're interested in funding for some of the pilot awards for this program. I'm going to stop sharing my screen at this point, and I am going to open us up for questions or comments. We've got about, looks like maybe about 20 minutes or so. And I understand that we're streaming live on Facebook as well. And so our Race Center staff will be able to give us information regarding any questions that come up on Facebook. Is there a possibility that graduate students could apply for a position with this program? If we have openings for the program, they would be available on the SCENE website. We're primarily funding research projects. As a graduate student, if you have someone that's working with you as your mentor who would be interested in doing some work in this space, please feel free to apply. Or if you have either some funding or a project that you're interested in working on that you would like to get some funding for, the answer is yes. But I'm not aware that we've got any positions per se nested within the program at this point that we would be able to fund a graduate student. Other questions or comments?
Hi, Dr. Miller. I do have a question. It's Marilyn. I had never heard of the underground cigarette market, and I'm just wondering if you could expand on what it is and what it does, please.
Of course. So I'm making an assumption here that just about everybody who is on the call today does not smoke cigarettes, but there may be a few people who do. And for the people who do, you may realize that the cost of a pack of cigarettes within the city of Chicago, last time I looked at it, it may approach $10 for 20 cigarettes. That's pretty expensive. And so if you think about this as an ongoing habit and that you may be spending $10 or $20 per week if you have a pack to a 2-pack a week smoking habit, you may look for other ways to be able to afford to have cigarettes. Some people go over to the state of Indiana. Some of you may be familiar with the little tobacco hut that sits on Indianapolis Boulevard that's just over the border from the city of Chicago. If you are going out towards the Indiana toll road, Interstate 8090, in order to get cigarettes that are cheaper. But this is part of that underground network in which people who have heavy cigarette habits are able to get cigarettes at a much lower price. Cigarette smoking, as we know, is a major contributor to heart and lung disease for all people. And so the question of how do we think about the underground cigarette issues within the Chinatown community as being potential contributors or factors is the reason why this particular person decided to apply for funding through our program. Thank you for the question.
Thank you.
Other questions or comments? Even though I'm approaching this program as a physician, I want to encourage any of you, particularly if you're early stage investigators who may have backgrounds in psychology or sociology, that if you are interested in applying for funding, to take a look at our website, because I think that there are opportunities, and if you can see the kinds of grants that have been given and look at the backgrounds of the people who have been given grants thus far, that you certainly would be eligible for funding.
I have a question.
Yes, Tracy.
I'm sorry I was late, so forgive me if you already talked about this. But I'm guessing that you mostly were focused on your work as a researcher and clinician. And I'm wondering if you could talk a little bit about some of your creative work that you do that's also connected to your work as a physician and clinician.
Thank you for the question. I have some broad interests, as Tracy just mentioned a moment ago. And one of the projects that I work on at the University of Chicago is something called WRAP, which stands for the Wellness Resilience Arts Program. That program is a cooperative program between the Logan Center for the Arts, the Crown School, Family School of Social Work, and also Urban Gateways, which is a community not-for-profit that specializes in providing trauma-informed teaching artists for youth. We've been doing this program now for about coming on 7 years, in which we work with youth between the ages of 13 and 18 that have been impacted by violent trauma in the community in some way. Some of the youth have been victims of violent trauma, some have been witnesses, and some of the, in rare cases, have been perpetrators. And we bring them in for a high quality arts program, which involves opportunities to interact with artists who specialize in visual arts, poetry and spoken word, African dance and drumming, beat making. And then in addition to our program this year, we're going to include filmmaking through intensives over a 5-hour period during the day. The reason why the Crown Family Schools social work interns are included is because we start and end the day of that period having a half-an-hour debrief with the social work interns around the kinds of projects that they're developing. And usually we start off with an artistic prompt that the young people oftentimes may be familiar with, that resonates with them around trauma in their communities. And then they develop pieces that are available for presentation, for a public presentation at the end of their experience with us. And in addition, we provide the young people who participate with a gift card of $100 per week for every week of participation. We've done it as an intensive during spring, Chicago Public Schools spring break. We've also done it as a 2 to 3 week program in the summer with a capstone at the end where they can invite whoever they'd like, family, friends, et cetera, to come and to participate in this program. When we think about opportunities to really be impactful with young people that have experienced violent trauma in our communities, oftentimes in more traditional settings, people think about having young people to go to see a therapist, whether it be a social worker or a psychologist. But young people who live in our Chicago communities oftentimes don't have access to those types of services, but they're looking for opportunities to express the issues that have impacted their lives, and to do so in a way that is somewhat at arm's length through artistic expression. And so having the opportunity to have this work done with trauma-informed teaching artists, I think, has been extremely critical. One of the people that we've partnered with over the years is actually not only someone who is a poet and an artist, but also is a licensed clinical social worker who has been able to combine both practices and brings that expertise to the table. Another one of our trauma-informed teaching artists that we've worked with over the years, and hopefully he's not too busy this summer and can work with us again, is Avery R. Young, who some of you may be familiar with. He was just appointed as Chicago's first poet laureate, and he's been a really strong supporter of our program over the years. And so we're hoping to be able to work with him again, as well as our other trauma-informed teaching artists through this program.
Thank you. I got a chance to see the capstone last year, and it was pretty amazing. It was a great performance and tour of an exhibition and installation and drumming and dancing. It was really great. So thank you for that work. And you're also a playwright, so I just want to throw that out there.
I've got a few things going on. Yeah. Other questions? Well, it sounds as if folks are a little bit quiet this afternoon. Marilyn, Chioma, any other questions? Or would you like to close out a little bit early this afternoon?
I have another question if no one else does. Sorry, I
Go
came in late. Did you, at the beginning, did you talk any about like your own personal journey to becoming a physician and like growing up in Chicago?
I did not share that part of my background. I was born and raised on the south side of Chicago, spent the first 9 years of my life just living just to the south of the University of Chicago neighborhood here in Woodlawn, and had the opportunity to go to medical school here at the University of Chicago in the 1980s. One of the reasons why I do this work, whether it be the work through the Chicago Chronic Condition Equity Network and also the RAP program that Tracy asked me about a moment ago and that I just described to you, is because of commitment to community and opportunities to be able to share my gifts and interest in this space with people who come from the same communities that I come from here on the south side of Chicago. All righty. Anything on Facebook that's come up at all? Oh, I see another question in the chat, actually. And it has to do with volunteering activities. It depends upon which program and also what you may be interested in. I'm going to drop my email in the chat again. If folks are interested in discussing any of the work that I'm doing offline, because we do have opportunities for volunteering, not only with the work that I do, but also through a program called the Urban Health Initiative at the University of Chicago. And so if there are opportunities through there, if you'd like to discuss further, please feel free to reach out to me. And for those of you who are on Facebook, may not be able to see the chat, it's DORIANE.MILLER at bsd.uchicago.edu. That's my email. And please, when you send me a note, reference that you heard about this through the Research Bites program through the Center for the Study of Race, Politics, and Culture. Okay, thank you so much. I had the wonderful opportunity to share a little bit of time with you this afternoon. And again, if you have additional questions, please feel free to reach out to me.